Hey guys, good afternoon. Happy Wednesday. Good to see everybody here on board. Today is a busy day. It's Wednesday. This is the day that you guys are shooting to get to, meaning passing your step one, killing your step two, and so on. So these are the days that we harness and we love to hear success stories. So today was a really good day for us. Many students that I worked with passed step one, step two. Average was 248, 253, 256. Good scores, great scores, actually. So I'm happy. Yeah, I'm just gonna keep going. We got to keep pushing forward because things get challenging. So today we do an MSK. Let's see who's chatting away. Hey, yeah, exactly, right. Good stuff. It's exciting. That's the whole point of working hard, is to get to this to the finish line, which is this, right? And it's sad because a pass is a pass with step one. And then it's like, well, it's short-lived because then you got to get back into the groove to either do step two or your rotations. Either way, it's one step closer to getting your license. So when you finish your rotations and you get into residency, you apply with your step one, step two, step three, pay a fee, submit all your scores, and you get your license to practice. Quick heads up, not every state has the same requirements. So some states require certain things from you, meaning some states want first attempts, other states accept multiple attempts. So if let's say, for example, you have an attempt on step one or step two or step three, you can't license in some states. It's just not possible. So there's a website I'll put in the training hub that you can look at it later. But again, it's something that you work hard to build your step one, to get your step two, to get your step three, and then you just apply to get a beautiful license. And it's a great thing. It's a wonderful thing. So today we're doing MSK skin because we have one full month, right? 4 solid weeks, 5 days a week for 4 weeks. We just keep going month after month. I created this curriculum to make sure that on Mondays we hit immunology, Wednesdays we hit microbiology, like this morning we did virology. Fridays we do biochem. Tuesday and Thursday mornings, there are Q&A sessions, whether people jump on and provide a success story or recent experience in any of the assessment tests, whether we discuss topics and we tackle it together like we usually do. It's your opportunity to voice and speak up and communicate with each other to make sure we have everything understood, because it's a shame to not have any doubts or fears or concerns, right? In the afternoons, we have our organ systems. So in one full month, 20 days, we cover every organ system twice. So I do my best to select these questions through Amboss to highlight what you need to know or what is usually tested on the exam, and then branch out. A lot of us here that I see in the room here are joining us every day. So many new faces, so welcome. At the end of the day, I'm here to help you leverage the exam. I'm here to help you get the points to pass step, because step is pass or fail. So think of it this way. We have MSK. MSK is pretty big. Anatomy, embryology, medications, imaging studies. So chatting away, I mean, you could please chat. You feel free to participate in the group chat. What do you think is certain areas, certain key points in MSK that we can use against the exam in our favor, right? Think about it. We have rheumatoid arthritis, we have osteoarthritis, we have tons of different medications that we need to know. Sure. I mean, you can open up your first aid and go through step by step all of MSK. But think of it this way. Why focus on certain things? Exactly. Osteoporosis, RA, OA, bone cancers. You'll see a routine that I have is, I'm here not to squeeze basic sciences in these sessions. That's not possible. I'm here to help you. Like this morning we did virology, right? So virology, we kind of covered pretty good stuff. And we went over hepatitis B, went over the markers, went over the different designs and the beautiful, which is torturous, drawing of the surface antigen, the E antigen, and what comes in comes out. So you should watch that video because it was very, very good this morning. The point is, I do my best to teach you guys what I can, to not memorize, but just to understand the material, right? But it's up to us individually to figure out what we can do to get points. And some stuff, unfortunately, is difficult to understand. So please don't fall into the trap of trying to understand it over and over and over and over again, watching videos upon videos upon videos, because I promise you that gets exhausting. And then you actually feel familiar, you feel confident, and then you answer questions and you're stuck. So please, if you're in the situation, if you're in your style, if you're in the pattern of studying or the stage of studying, that's awesome. But I know all of you here personally. I know most of you guys have covered the material at least once. So now it's like, well, why am I not getting the questions right? And this is why you're here, to help you read the scenarios, to help you focus heavier on the why and more than just, I got to read more content. Yeah, you guys know the material. Listen, you read it once, twice, it's there in front of you. The problem is, why are you not getting the questions right? And those who know me, I always ask, hey, what's your stats? Okay, cool. Why are you getting them wrong? Well, you got to know. I can't tell you. I'm not doing it for you, right? So that's why. Let me just open up my first aid over here, because my first aid is my friend. I'm here to help you guys. There we go. So it's online community. We're here as a team. Looking at first aid, there's a lot of stuff in MSK, right? MSK, skin connective tissue. I know you guys know this information. I know you've seen this over and over again. It's familiar, right? But when you get something to like this, and you have all these ups and downs, this can give us a little panic, get a little nervous, or you say, you know what? I need to know as much as possible about these bone disorders, because they can throw porosis at you, obviously. Petrosis, Petra in Greek is stone. Paget disease is famous. This is always tested, even in my days. The brown tumor, for some reason, it's a beautiful test writers. Obviously, we know about osteomalacia, but are you familiar with the calcium and the phosphate and alk-phos and PTH? Are you familiar with it? Do you know why it's up versus down? What I used to do is I used to memorize the arrows. Horrible way, because wouldn't it be nice if you can just kind of understand why, right? If you just memorize the arrows, it's short-lived. So what I do is, when I'm explaining to you, is as you study system by system, right? I hope you know the curriculum that I've created here, it's hard to keep up unless you've done everything, unless your test is coming up soon and you just want to be hitting everything every day. I'm showing you the techniques and test taking. I'm showing you how to leverage the questions. I'm also opening up and explaining to you, hey, when you get to MSK, like we're doing questions today, do you really know your stuff? And if you know, that's fine. You take notes, you answer the questions when you can. So when you do get to MSK, you're like, you know what? I've seen it in class. I'm not good in X, Y, and Z. And you have to go back and learn the content. Because when you have tumors here, bone tumors, do you guys know the benign tumors versus, and when you go further down, the malignant tumors? I mean, every system has cancer in it. So if you can tell me the osteosarcoma and the chondrosarcoma and Ewing sarcoma are the malignant tumors, that's a pretty good way to differentiate them, because they'll give you a list of bone tumors and just bone diseases. And if you know me, we talk about, in neuro, we talk about location, right? We have age, we have location of the tumor, supratentorial, infratentorial. Lung cancers, periphery versus central, right? Bone, the same. Look at the locations. Don't you understand? And haven't you seen many scenarios where they throw the metaphyses and diaphysis and diaphyses location in the scenario? Of course they do. So if they mention this location, you know what disease bones exist. If they mention this location, you know it's osteosarcoma. But the problem is we're familiar with it. But when it comes to answering questions and applying the knowledge that we have, fortunately, we dropped the ball. I promise you, because I used to drop the ball. I think I know it, but then I don't know it, and that sucks, right? So follow along with me. We do questions. Again, I'm doing my best to show you the points. When you see something like this, ladies and gentlemen, osteoarthritis, rheumatoid arthritis, I know you might say, Stavros, listen, man. So Wednesday afternoon, I know my stuff. Okay, cool. But do you really know it? Because they will ask you questions on little details, whether it's HLA-D4, maybe you know, maybe you don't know that, right? They might ask you about the joint findings. Are you familiar with it? And if you say you are, good. Prove it to yourself, prove it to me. We do questions together live, right? We're here to help each other out. Some of us starting back up, other ones, I mean, typically everyone's on their own, right? You're home or you're in a library or your parents' house, your apartment. There's no one classroom physical. This is an online setting. And I know it's stressful when you're studying because you're by yourself and you're maybe not motivated. So that's why we meet each other twice a day, morning and afternoon, to keep pushing forward. That being said, do you know this stuff? Do you know if they present to you physical exam findings, maybe more of a joint findings, the presentation, predisposing factors, pathogenesis? I hope you do. This is how you get points. Don't go searching for stuff that's challenging. If you can't get the easier concepts, I laugh because this is me. I would go, oh, I don't know this. Yeah, but how about the other 65% of stuff that you should know? Yeah, I don't know that either. Forget that. Focus on this first. And then when you get this done, then you do the others. So gout, pseudo gout, reactive arthritis, this stuff is big, right? So prove it to me, prove it to yourself, know the information. How many times have we done reactive arthritis? Can't see, can't peek, can't climb a tree. Come on, we've done this so many times already. But still, test writers create questions that are challenging. So raise your hands or put in the chat box if you guys use first aid all the time. I hope you do. But if you are using first aid, please just don't dry read. It's not going to help you. I need you to apply. I need application. Okay. So let me just change my screen a second. Let me just share screen again. I'm here to help you all, right? I'm here to push hard. Raise your hands up high if you want to participate in 2 questions. I hope you want to do questions with me. This is why we have these live sessions. Now, some of us, we don't want to jump on live. I get it. But I want you, if you don't want to participate live with me, at least you can go and type like you usually do in the group chat, answer choices. I need you to practice the content, right? Dr. Singh, I see you here. Dr. Singh, come on board. Dr. Singh, let's do it. I don't think anybody else is going to participate. I need you to do questions with me. There you go. There you go, Dr. Singh.
Hello.
How you been? How you feeling? How you feeling? Good?
Good. How are you?
Good. How's you, by the way, for those who don't know Dr. Singh, she's on the West Coast. And, she did share that she has to take an exam sometime soon. She's getting back into the swing of things. So the morning session, she gets up at 6 a.m. to join us. That's pretty cool, right? Thank you for that. How was your day today studying?
So far, it's going well. I did a few questions earlier today, so I'm gonna try to see if I can do a full block by the end of the day.
Cool. Full block meaning 40 or 220s?
40, but separating them by tens.
Cool. The reason why I bring that up, ladies and gentlemen, is please do not force yourself, do not torture yourself on doing 40s. If you can't do 40s, trust me, it's not easy. Do blocks of 10, blocks of 20. I hate when you have a block of 40 waiting for you and it's there just lingering for a day and a half, right? It's a mind game. Just got to change it up. Do blocks of 10 to get better and better. It's simple as that. Yes, yes. Awesome.
Yeah.
So I chose questions here and you can go through all of them at your leisure. If you have any questions with the Training Hub, I'm always here to help you. If you have Amboss, right, you can utilize the link that I provide because I want you guys to do as much as possible. That's the whole point. I need you guys to participate and work hard, right? Good. I have hands raised. Are these hands raised to do questions after Dr. Singh? Or do you guys have questions or concerns or comments? Let's see, chat box away. To do questions. Awesome. Cool. All right. So I'll do 1 or 2 with Dr. Singh. We'll do 2 questions each. We'll do round robin. Cool. Awesome, guys. Perfect. Perfect. Thank you for participating. All right, Dr. Singh, let's do a couple of questions. Let's do 2. and we'll round robin, all right? How do you feel about MSK, Dr. Singh?
I feel like I'm good for the most part.